Welcome to the HBOT News Network. We're here with Dr. Harch and blessed for the continued conversation that we're having with him. And in this conversation, I think what would be very helpful is to cover a lot of the indications that he's experienced with that are in his book. And so we can just get snippets. And what I would recommend, clearly, if this rings a bell for you or you're dealing with this, that you get a copy and you can read much more about it. So welcome, Dr. Harch, and thank you for continuing the conversation here at the HBOT News Network.
Again, my pleasure. This is really a great experience.
Well, okay, so in chapter 11.
Yes.
We'll just get right through it, right? AIDS, hyperbaric oxygen.
Very interesting. So hyperbaric oxygen does not have, that we know of, much direct antiviral effect. It's been shown for hepatitis C and maybe at high pressures and oxygen levels for some viruses, but in general, it is not necessarily toxic to the virus. But as we know, I mean, AIDS is an immunosuppressive disease, and the virus is only part of the story. It's largely a toxicity to the immune system by many contributors. And so what has happened is we have a dysregulated immune system and the damage that results from that. And of course, one of the primary targets of damage is the brain. And in early studies that were done on this back in the 90s, what they showed was it is primarily attacking the white matter in the brain. And this is where so much of the cognitive problems and symptoms, complaints, deficits come from, is this damage to the white matter. And if we now go back to what I had mentioned before in hyperbaric oxygen, where is some of its greatest benefit is in neurological diseases that involve the white matter, traumatic brain injury, decompression sickness, carbon monoxide poisoning, small vessel vascular disease in the brain, other forms of toxic brain injury, etc. And so here is a potential application in AIDS patients with injury to the brain, and of course potential effects on the immune system. Well, what ended up happening in the early 1990s, there was a study done at the University of Maryland Shock Trauma Center. And the study was reported at a meeting in 1992 at the UHMS meeting. And what they measured was the Karnofsky scale, which was a quality of life and measures fatigue in patients, been used in MS and other multiple sclerosis and other types of neurological diseases. They measured this in these AIDS patients and they claimed that they improved. Well, it got all wrapped up in a lot of politics and they didn't know what exactly they were treating. I was on the panel that moderated the presentation and I recommended to them, you didn't look in the brain. You're likely treating the white matter, is where the white matter injury, the indirect or direct effect of the infection or maybe the immune system dysfunction. There have been some other work on this. There was a report on use in some scuba divers, lobster fishermen in Puerto Rico who had AIDS. And what they found was an improvement in their blood counts and their, overall health doing the scuba diving in their lobster harvesting. And again, there was even a patent that was applied for on use of primarily air pressurization treatment of patients with AIDS. Whether it had a direct antiviral effect, it was claimed in the one study by Michelle Riello, who was the nurse at Shock Trauma. I don't know, I haven't seen much more about it, and there hasn't really been much follow-up on it. But if I had AIDS, it'd be worth a try, especially coupled with other therapies that are done. So, a possibility.
Asthma.
Asthma. What is asthma? It is an inflammatory disorder. In fact, it is lung inflammation that is the dominant part of asthma. The net result of that inflammation in the lungs is constriction of the airways. So there have been studies done on this with asthma, in particular more COPD, chronic obstructive pulmonary disease, of which asthma is a type of COPD, and this was done in Israel, where they took patients from, I believe it was Jerusalem, and I got to see if I got this right, but I think the altitude is about 3,800 feet to the Dead Sea, which is below sea level. And they had them live at the Dead Sea for 3 weeks, and they measured a host of pulmonary functions, and I believe they measured some inflammatory mediators as well. And what they found was an improvement in pulmonary function while they were staying in the Dead Sea for those 3 weeks, with an increased pressure, a significant increase compared to where they came from in Jerusalem. And when they returned them to Jerusalem, they maintained much of those pulmonary improvements.
Interesting, and I read some of that in the book, and I guess some of them got off their oxygen while they were there, and they were in that environment for several weeks.
Yes, for 3 weeks. And that's a little different than what we're doing with intermittent treatment, but there is experience with that on pulmonary function. And remember, it's an inflammatory problem, and hyperbaric oxygen is anti-inflammatory. So I don't know that we're growing new lung tissue per se, but we very likely are inhibiting the inflammation in the lungs.
Well, and historically, I think people went to the Dead Sea to heal. They just didn't know why.
Yes.
Right? So
exactly.
That's part
exactly.
of it.
It's likely the increased pressure. And of course, there's the famous case of Dr. Edward Teller's wife. Dr. Teller, the father of the hydrogen bomb. His wife was a unfortunate, tobacco addiction, terrible smoker, and had destroyed her lungs, was on supplemental oxygen, and now had dementia from both the effects of the tobacco, cigarettes, and the hypoxia. And when Dr. Teller had his stroke, and Dr. Richard Neubauer sent a hyperbaric chamber out to him to treat him for his stroke, they decided, Dr. Bill Maxfield's brother from Dallas, Texas, decided to have Mitzi Teller also be treated for her pulmonary disease. Not only did she get off oxygen, and she was dying at the time, it rejuvenated her. She lived another 5 years, but her dementia was ameliorated, not cured, and she had a fairly noticeable and dramatic improvement. And it was purely treating originally the lung disease, but also her brain.
And if I get the story right, Teller himself lived into his 90s, and he attributed hyperbaric oxygen to the fact that he was able to keep as sharp as he ever was from the physics standpoint through to the end of life.
He had some 3,000 treatments, and in 1994, Dr. Neubauer had invited him to a conference. He was on the board of directors of the American College of Hyperbaric Medicine and the American Board of Hyperbaric Medicine. And there was the opportunity to have lunch with him. And I elbowed my way to the front because I wanted to sign up for lunch with him and just sit and talk to him. And so I got to sit next to him at lunch, and I said, "So I hear you're doing hyperbaric oxygen." And originally he started it for his hip. He had a hip problem and found that it made good. And I said, "Why are you doing it?" He goes, "Well, we have very little, if no evidence that this is harmful, and all the evidence that this is potentially beneficial. What do I have to lose?" And so here was a guy, at the top of the physics world, active with his mind even after stroke for, into his late 80s, early 90s.
Yeah, and in his passing, he wrote a letter, didn't he, to talk about how we needed to study hyperbaric oxygen and apply it more.
He was a vocal advocate.
Yeah.
Yes.
Well, and so we'll continue here. Lyme disease.
Lyme. Okay, that is a very difficult disease to treat, and it's hard to know whether you're actually treating the active Lyme or you're treating the residual effects or the neurological injury from the Lyme. There's only been one study done on this in Texas, and interestingly, the patients got worse during treatment and then rebounded afterwards, and it was claimed that it was due to die off of the actual Lyme organisms. I'm not so sure. I don't know that it may have been mixed with some overdosing of the oxygen or sensitivity, their neurological injury, because they were given a pretty hefty dose of oxygen. I have not treated a lot of Lyme patients, and I don't treat them with hyperbaric oxygen unless they're getting an active treatment for their active Lyme infection, or there's some certainty that they are no longer actively infected, but they've got residual neurological injury. because it's difficult to dose them. They can be very sensitive to this, and especially when they're actively infected, you get these what are called Herxheimer reactions, where the bacteria dies off and they feel pretty ill. So I like to say that there's potential that this could benefit them, especially if it's active Lyme in conjunction with some anti-Lyme therapy. For residual injury, yes, this could be helpful. There's just not a lot of information. And the doctors with the most experience on this don't really talk about it. I mean, it's kind of done in a speakeasy fashion because the insurance companies, because treating Lyme is so expensive and long-term, the insurance companies have gone after many of the Lyme doctors, reporting them to medical societies for treating non-disease, for inappropriate billing of the insurance companies for all the tests and therapies and so on, such that there is not quite the open exchange of medical information on this that we would like.
Well, it seems like there's a following of individuals that have had hyperbaric oxygen that had Lyme disease, and they swear by it. Like it's what helped them. And to your point, possibly what it is doing, it's helping all of the residual effects of that disease.
Yes.
And that's what they're really feeling. They didn't get rid of the Lyme, but it's helping to heal the damage. In
principle, I'm saying that yes, this makes sense. It is one of those 139 diseases that, based on the pathophysiology and what we may be treating, yes, it makes sense. But we don't have a lot of solid proof, if you will, and information. But if I had Lyme and I'm having trouble and negative results, getting healed from it, I would try it.
Migraine headaches.
Migraine headaches. What is the cause of migraine headaches? A lot of information and controversy about that, but it seems to be a reactivity and sensitivity of cerebral blood vessels and their contraction and dilation in response to various stimuli, chemicals, hormones, trauma. You think about it, with a traumatic brain injury, post-traumatic headaches are one of the most common persistent symptoms. Interestingly, in the studies that were done with hyperbaric oxygen, it's also one of the most responsive symptoms. So for instance, in trauma, when the head hits something and the head stops, the brain keeps going. And the brain is compressed against the inside of the skull as it, moves around or ratchets around. Well, what is between the brain and the skull? The covering of the brain and the blood vessels on it, which is where all the sensitivity of the brain is located and may in fact explain the post-traumatic headaches. So, and some of which are, reactive blood vessel type of headaches, migraine headaches, and they do respond. So there's published information on this. And it is a little mixed in terms of, quote, migraine treatment with hyperbaric oxygen. But for instance, other types of headaches like cluster headache, the accepted treatment of choice is oxygen, high flow oxygen for cluster headache. And so I kind of, while they're not identical, put it in that same group of a headache due to internal structures and or nerve blood vessel problems and such. And I have had success treating people with migraine headaches of various causes. It's not perfect, but it's a possibility and something to definitely consider, especially with intractable migraines.
Can you throw a percentage at it? You have migraine headaches and they come into you, what percentage?
That's hard because again, it's my experience, a lot of it is with post-traumatic migraines, like the veterans who have blast-induced post-blast migraine headaches.
To a person, that goes away for most of them.
And it was, I think, 93% in our study had relief of headaches.
Almost
or improvement.
Instantly, too. That was one of the first things. That and sleep, I think, were the two big numbers.
And that was Dr. Bill Duncan's family members 6 concussions, intractable migraines for the first time in I forget how many years. He had complete cessation of his migraine headaches after 2 treatments and has not had a return.
Yeah, so,
That was 2001.
yeah, so
21
if
years.
If it's debilitating, try it.
Exactly.
What's it going to take? Chronic
And I would
fatigue-
tell you, just a last little comment. I have an orthopedic surgeon with, poor woman, with, intractable, almost daily, at least weekly headaches, who has now found relief that has significantly changed her life and ability to practice using hyperbaric oxygen. And of course, she has tried everything.
Oh, what a great story there.
Yep.
Chronic fatigue syndrome.
Chronic fatigue. Problem with chronic fatigue is, what's the cause? And where is the chronic fatigue located? I would argue that most chronic fatigue patients, it is a brain-based symptoms. RPMs in our body, I like to say, are located here, not necessarily here. Although people with chronic fatigue can have mitochondrial disorders where they've got poisoning of the little energy organelle in each of the cells in our body that give them an overall, lowering. Well, of course, the brain has the mitochondria in it as well, in each of the cells. And I've had success treating it, but I usually try to identify the cause. So I've had patients with chronic fatigue secondary to carbon monoxide poisoning, or chronic fatigue secondary to other forms of toxicities, chemical toxicities, what are some of the other conditions? Mold, let's say, that has caused kind of a chronic fatigue syndrome. And so chronic fatigue, it's hard to give an exact percentage for that in terms of response to hyperbaric oxygen. While it can be very successful, it'd be nice to know what you're treating. You can try to identify it, and then we can be a little more specific because you're treating a certain pathology. But in many of these cases, it's not identified. There's been some occult problem that caused it.
Okay, so for me, looking at the international indications that are treated worldwide,
Yes.
when you look at all the different countries and facilities out there, and looking at your list in Chapter 11, I mean, it goes on. A lot of it, at least appears to me, is that there isn't sufficient evidence, and evidence coming from research. So clinical trials and true,
Yes.
double-blind,
Right.
and peer-reviewed, and all of those buzzwords that I think we're hearing more now than ever before because of some of the science that didn't come out about the COVID issue, and so ivermectin and hydroxychloroquine were all bad-mouthed, and they're horse drugs and things of that
Well,
nature.
but that's a simple dishonesty issue. There are 33, I believe, randomized trials on ivermectin in COVID.
Yes.
And 70-some trials, I believe most of them controlled overall. That is just a dishonest denial of the evidence.
Mm-hmm. Much like the traumatic brain injury evidence for hyperbaric oxygen. So,
Yes.
so it is subjected to some of that. Let's talk about long-haul COVID, because I think you might be treating some individuals with that. What can you share with us about that?
I've treated quite a few, now over 20, I think, about 20. Well, what is long-haul COVID? First of all, COVID, yes, it's a viral infection, but what determines overall morbidity, how sick you are, and death, is the degree of your body's inflammatory response, and somewhat lack of it. But overall, it's an immune system reaction that determines the severity of the disease. And people who have various comorbidities, the number one of which is obesity, their immune systems are dysfunctional, and they can have even a greater abnormal immune response that results in their death or severe problem. Well, there are a substantial number of people, though, from just the immune response that is generated by COVID who have persistent inflammation. And it varies as to what part or organ system in their body has the dominant inflammation. Some people, in this routine, really random study of people who were discharged from the hospital, survived COVID, where they did MRIs of the heart, 74% of them had inflammation of the heart. Now, they weren't all symptomatic. In fact, I'm trying to remember how many of them were even symptomatic, but what it's saying is that the inflammatory reaction caused by COVID can affect any part of our body. And in a sizable number of people, it does so on an ongoing, lingering basis that then causes symptoms. Or I should say, the symptoms are continuous with the acute infection. And once they've been there for at least a month, it's considered, this long-haul COVID syndrome. Well, again, the nature of it is inflammation, a dysfunction in the immune system. What is hyperbaric oxygen? And what is one of its dominant effects on disease pathophysiology is the effect on inflammation and a dysfunctional immune system. And so I had been referred a number of patients, and interestingly, ivermectin has a role here as well. Why? There's likely no residual virus that's causing the problem. And ivermectin is antiviral at higher doses primarily than what we give people, but ivermectin is anti-inflammatory. Mm-hmm. And that's where likely its benefit occurs in acute COVID and even in long haulers. So what had originally happened is one of the news stations came to me and said, look, have you treated anybody with COVID long haulers? I said, no, I'm waiting for a patient to be referred. And she said, I have some people I'd like to refer. Would you treat them and make a documentary of it with us, with their permission? And I said, sure. Well, first few people were doctors' wives. And so, and like any patient, but, I informed them and obligated that, hey, why don't you try this drug first? And a couple of them did, and it didn't happen. But the long story short is we haven't been able to use the imaging and so on to really document the response. But of the 20 patients I've treated, 19 of them have improved.
With the long haul COVID?
Yes,
Mm-hmm.
yes.
How many treatments?
It varies on how soon you can get to them.
Mm-hmm.
And in some people, it can be a permanent effect. Others, you have to continue to periodically suppress the immune system. So the dose and the amount varies. It's a practice of medicine issue. It's not a rote thing where you give someone X number of treatments. But by the time they've had it 6 months, it usually takes about 40 treatments. And when you're in that long-term phase, to try to suppress it and repair some of the damage that the inflammation has done.
So it seems to me that, you get into this, the international indications, anybody that's suffering from any of those indications
yes,
are likely more susceptible to the long haul COVID because of the immune system and what they're already fighting. And so clearly hyperbaric oxygen is going to help them even more so now that they have this bioweapon, as many of us have seen evidence that it could be.
very likely. And there's now a randomized trial that's been published out of Israel on this, showing benefit of hyperbaric oxygen in long hauler syndrome. And they had, the patients were deemed to have had long hauler syndrome after 3 months of persistent symptoms. 2 weeks ago, I gave a short lecture on this and the evidence on the FLCCC weekly webinar. This is the Frontline Critical Care COVID Alliance of doctors that internationally have banded together to show the evidence that anything can affect COVID, and that, besides vaccines and the standard treatments that have been leveled, meaning some of these medications with significant side effects and toxicity. And they have published and shown all of those ivermectin trials, hydroxychloroquine information, et cetera, et cetera. Anyways, gave a talk to this, and they are now having their first international conference in mid-October, I think the 15th and 16th in Orlando, Florida. And I'm going to be giving a talk, a longer one, on all of this evidence for acute COVID, hyperbaric oxygen, subacute or long hauler syndrome, and vaccine injury.
Well, and I hope everything else.
Yes.
And
Well,
they're open-minded to all that, because if they're
They are.
critical care, an acute environment certainly is tremendous benefit, as we certainly have talked about in these conversations. Vaccine injury, you just touched on it.
Well, what does a vaccine do? It stimulates the immune system, revs up the immune system. The problem with the vaccines, and especially we're seeing now with the COVID vaccines, the COVID vaccines stimulate an immune response, but they underwent no long-term testing. So this really was a massive population medical experiment in terms of generating long-term effects to find out both effectiveness as well as side effects. The documented side effects, and these are underreported, as are all vaccine reactions, but the documented side effects now through the government's vaccine adverse events reporting system, the VAERS system, is greater than the sum of all vaccine adverse events reported through that system in the past, it's either 3 or 4 decades. I forget how long it is. It is a huge number. And
I think since the report started.
Yes. And again, it's been acknowledged that it is vastly underestimated. Some have proposed the figure as many as 1/40th the incidence of true vaccine reactions. Well, those vaccine reactions are immune reactions. It's a stimulation of the immune system. And again, what is hyperbaric oxygen? It is a treatment for immune dysfunction and inflammation. And so if you'll see in that little webinar that I presented, one of these patients was COVID long hauler, who then in the midst of it went and got a vaccine booster and just exacerbated all of her symptoms. Mm-hmm. And then I treated her after that, and she had a positive response. But it's an inflammatory problem, and we're essentially treating that with the hyperbaric oxygen. So now that's only one case, but there are others now that have been treated. And there are more and more people who are stepping forward and volunteering case reports on this.
So long haul COVID, vaccine injuries, hyperbaric oxygen is there to help. And so hopefully people hear that loud and clear.
Potentially. We don't have as much information on the vaccine injuries. It is accumulating. We do have, for COVID long hauler now, there's a randomized trial documenting and reaffirming my experience and even others now. And there are multiple studies for acute COVID infection. Those are a little more mixed, but the general effect is one of positivity. And I forgot. In January of 2020, when the pandemic got rolling out of China, my wife said to me, she said, "What about hyperbaric oxygen for acute COVID?" And I said, look, everybody forgot the history of hyperbaric medicine. Where was the advent of hyperbaric medicine in the United States? It was Spanish flu pandemic, which is essentially a relative of the coronavirus. And it was Dr. Cunningham in Kansas City who, in Colorado, vacationing in the Rockies and realizing that the mortality from Spanish flu was so much higher in the Rockies, and got to thinking, well, wait a minute, we have lower pressure and lower oxygen. Maybe that's what's killing the Spanish flu victims in the Rockies much more. What would happen if we increased the pressure and the oxygen? And I mean, literally raced back to Kansas City and cobbled together from spare parts and an old boiler this hyperbaric chamber. The day it was operational, when they were to start his animal experiments, he was brought this dying, and the description is in Vance Trimble's book, The Uncertain Miracle. It's published in a journal article, a medical journal article also. This moribund, a gray young man who's taken his last breaths almost from Spanish flu. And they describe putting him in the chamber and treating him, no oxygen, supplemental. Pressurized air at 1.68 atmospheres, and talking about how he started breathing and pinking up. He did one treatment a day for 5 days, and the man lived. Next thing you know, he was flooded with patients, treating them and salvaging them for Spanish flu. Well, that was before antibiotics. Half of Spanish flu mortality was the death from the secondary bacterial pneumonia. The other half was the direct effect from the same thing that COVID's causing in the lungs. And that's what he was salvaging. So we put this announcement, she kept saying to him, why don't you put something out on this? We put an announcement out in March that history bears remembering. And please look at this. It turns out now there are multiple studies. And I published a little commentary in a journal on this that looked at some. The next day we found an article that had been pre-released out of China. The doctors in Wuhan at a hyperbaric center had treated 6 COVID patients. And they were trying to get it published. Well, within a day or two, I had an interview with them through a translator. I located the doctor and talked to him about it. And the net result was they treated 6 of the most seriously ill ones, and then they were forced to treat 29 lesser infected and ill ones by the hospital administrator, because the other patients in the hospital with COVID saw how quickly these near dying patients with COVID improved with the hyperbaric oxygen. They demanded it. This is China, right? Where, I mean, you don't have control over anything. You can't demand anything. And the hospital administrator made them treat these 29 others. And the doctor, in our conversation, I told her about Dr. Cunningham. And she said, that's what I've tried to tell our doctors, that it's pressure as well as that increase in oxygen.
Well, I know that they did a study in New York University Hospital.
NYU, Long Island, yes.
Yeah, and of course, great results. One patient did die, and
yes.
that was after a treatment. They were probably too near death to help
Well,
them.
no, what happened is apparently he or she had fallen out of bed, and their oxygen in the ICU had come off. And there was an event related to that. It was not the hyperbaric oxygen, but something that happened afterwards.
That tied the study up, and now it's in
Yes.
review. And so 2026 we'll probably see it, because they don't want us to know that the ventilator was the wrong tool for the job, that hyperbaric oxygen was the tool that we should have been mass producing.
They've already published that initial cohort. Now, I don't know if they've got a subsequent study. I think they might. I don't know. But there are other ones now that have gone on. There's one up in Sweden. There have been, what I reviewed are 9 publications on acute COVID.
So it's like everything else, though. Who knows about it? And they're still putting people on ventilators.
That's why we're trying to do this.
So let's wrap it up. I have one question
All right.
for you. And this is
Sure.
not a pre-planned question.
Okay.
If God could give you one miracle related to hyperbaric oxygen that you could request and get, what would that miracle be?
The mass distribution and access of this therapy, to where this would be like a physical therapy, going in and getting your knee rehabilitated. People could go in and at a low cost be able to get this therapy for their condition. So it'd be ready access, ready availability, and no barriers to doing it. That would be the miracle.
Well, so then would you join me in a prayer?
Sure, of course.
So I would like to ask the Lord Jesus Christ, my Lord, to request from our God the Father that we allow hyperbaric oxygen to be utilized by anybody that can benefit from it throughout the world, and that the the discussion, the conversation that we've had here the last couple of days be spread far and wide, and that people do capture that and understand the value of what he gave us and he created, as I believe, on the second day of Genesis. In Jesus' name, amen.
Yeah, amen.